Fernandez, His Excellency Fernandez Baraza, the Deputy Governor, an old friend of mine. I was his leader many years ago. The leadership of the County Assembly and the Chair of Health, my PS Oluga, the CEO of Digital Health and the CEO of Social Health Authority, county leadership, our valued healthcare workers, good afternoon. It's a great honor for me to join you here today for the activation of Taifa Care. This is a very historic step in making our healthcare affordable, equitable, accessible for every Kenyan. Taifa Care digital health transformation will enable us to have a paperless system that speeds up claims processing and prevents fraud. Using fingerprint verification, and in all our level 4, 5, and 6, we are providing biometrics. So you not need to carry a SHA insurance premium card. You just need to go with your fingers. We verify you with our data, and this will give you a direct access to health services without presenting any physical documents. We will reduce paperwork. We will reduce the queues you see in our hospitals, and it will allow us more focus on the patient. For many years, the patient suffered in our country, but the boss, in going forward, the boss will be the patient. I want to thank Governor Baraza and the county leadership for welcoming us and for working with us. When the national and the county government work hand in hand, they become 48 governments. They become one nation, and who wins? It is our people who win. But I want to say something about, I have gone to many counties since I became the Minister for Health, and I can tell progressive leaders in the healthcare system. I've been to Kisumu. I saw Professor Anyang' Nyong, a very, very progressive and vision governor. Governor Baraza is a very progressive leader, and he works with us very well in the healthcare sector. Taifa Care is about protecting families by integrating the Social Health Insurance Fund, the Primary Healthcare Fund, and the Emergency Chronic and Critical Fund. We as a government, under the leadership of President Ruto, we are ensuring that no Kenya is left behind. No household is bankrupt by illness. KAKAMEGA, in demonstrating strong leadership, has registered in our data 818,961 residents. That is accounting for 44% of the population of Kakamega County who are enrolled in SHA. This will give them access to free outpatient healthcare services at level 2, level 3, and level 4. Let me make it very clear. For Kenyan citizens who access level 2, level 3, and level 4 for outpatient, they are not supposed to be charged anything. Wale wa Kenya ambaye wataenda kutafuta matibabu katika dispensary, health center, and some of our sub-county hospitals as outpatients, all they need to do, and it's mandatory, they must register with SHA, and they go to those hospitals, they are treated, and they go home free. And the governor knows. Now tumesikizana na Governor Baraza and the county health leadership. Kwa vile kuna Wakenya wengine wakisikia rais na waziri amesema ni free, wanaenda hata bila kuregister SHA. Na wanasema Sisi tunataka tutibiwe na tuende nyumbani. Mimi nataka, nimemwambia governor aweke desk pale mbele ya dispensary na health center na sub county. Aulize Mkenya kwanza uko na SHA. Kama hana SHA kwanza akuwe registered. He just needs to give his ID card. Unapiga *147#. Akuwe registered, atibiwe na aende nyumbani under the primary health care. Kwa sababu yeye atatibiwa na ile capitation pesa ya 900 county government itapata. We want the health care to be the largest own source revenue for the county government. Na pesa sasa inakuja direct kwa facility. IPT county treasury, ili wale wahudumu katika hiyo hospitali, hiyo dispensary health center, when they get the money, they use that money to provide the services required. Wanunue madawa, walipe watu na wa improve the facility. Additionally, 450 residents in this county have completed the mean testing and an average of 605 shilling. However, only 27% of these, about 224,334 people, have paid their premium, which will enable them to access inpatient services at our level 4, 5, and 6. We therefore urge families to pay their SHA contribution and transform registration into a meaningful health protection for our loved ones. The Lipa SHA Pole Pole model is proving very effective for the informal sector, allowing flexible premium payments on daily, weekly, or monthly. This approach brings closer to the universal health coverage to all Kenyans, regardless of their income. On providers, Kakamega County has 167 facilities which have been empaneled, including 126 public facilities. But empanelment alone is not enough. We must activate every facility and ensure every claim translates into care for our people. Nationally, SHA has disbursed, tangu SHA imeanza mwezi wa Novemba, Oktoba, tume disburse bilioni 53 through SHIF na bilioni 7.7 kupitia the primary health care fund. In Kakamega alone, Kakamega County, all facilities, public, private, faith-based, have received 1.2 billion since SHA started. And I'll give you the breakdown. Kakamega, all the public, private facilities and faith-based have received 1.2 billion. Kakamega Social Health Insurance Fund, all these facilities, that's level 4, 5, and 6, both public, private, and faith-based, have received, in Kakamega County, have received 449 million. In the primary health care fund, all the facilities in all categories have received 410 million. But for public facilities, ya county, and we have done all the numbers with the governor today, and we have agreed with his numbers, and by 14th of this month, we will pay, particularly the county referral hospital, a total of 100 million shilling. And governor, if they don't pay by 14th, they will be him. Because, you know, we want our patients to have dignity care. Na leo mimi nimekaa na baba askofu wa Kakamega kwa hii maneno ya St. Mary's. Na mtaona kwa mtandao, because I have done a press conference with him. Alisema tangu SHA imeanza kwanza wanalipa yeye kila mwezi. From December to August, diligently SHA has been paying St. Mary's Hospital. Na ame receive pesa takrimu 98 million. Wengine walikuwa wanasema ati 9 million, 3 million. Askofu mwenyewe tumemonyesha bank details, tumemonyesha RTGS, tukamwongelesha ongea na cooperative bank manager ule ana receive pesa. Tukamwambia tuko na balance yako ya hii. By 14th of this month, by Friday you receive money, by 14th atapata 14.3 million. SHA has not closed the registration portal of St. Mary's. Kenya Medical and Practitioners and Dentists Council, the regulator. I'm told there's somebody here. I was told there's somebody from KPMDC. Yeah. Hawaja close your facility. They have not closed it. St. Mary's has all the license. Kama ni pesa tumelipa. And we don't want people to bring politics into the healthcare of our people. Let us take politics to other things. MCS. Mkena matanga muongea maneno mengine. Lakini you cannot do politics with the health of our people. Na mimi mkiongea, nitaongea na nitaleta ushahidi. Unajua mimi ni mwanasiasa. Na sasa sitafuti kiti. I want to fix the health sector in this country. Mimi sitafuti kiti. So mtu ukiongea, mimi naongea. Si hata wabunge wameongea. So niambia watani impeach. Si nimeongea. Wale wanza kuni impeach, wengine nimefunga hospitali yao. I have closed the hospitals. You know, unless you say the truth. Hapa hii Kenya na wengine wametumwa na hii wakora. We want people to provide healthcare services, lakini iwe ile ambaye ni halali. Usikule pesa haramu kupitia wagonjwa. It is immoral. Ama nyinyi mnataka pesa wagonjwa ibiwe? I have gone to the hospital now. I saw the latest CT scan. Thank you, Governor. And because nimeambiwa the patients are many, in a day between 50 and 60, we have agreed with the governor, we bring another CT scan. Yeye halipi, hanunui. Sisi national government hatununui. Supplier analete, Mkenya akitumia pesa anakatiwa yake na analipwa na SHA. So we are not investing in these machines. Yeye pesa ya anunui machines. Sisi Ministry of Health hatununui, lakini mgonjwa wa hapa Kakamega anapata facility ya CT scan. Very modern, the latest 128. Let me stress this. Where money flows, fraudsters follow. Unasikia? Fraudsters hawaendi mahali hakuna pesa. Where money flows, fraudsters follow. We have already seen false claims. Outpatient cases billed as inpatient. Wakenya wanaenda hospitali kama outpatient. Wanatibiwa, wanaenda nyumbani. Lakini hiyo facility inaandika inasema wamelala kwangu siku 20. The biggest fraud we have found out is where you turn outpatient into inpatient. And as we stand here, our system can tell us. This morning we have told the governor, from our dashboard in MOH, we can tell all the bed occupancy in all our hospitals. Ndio sikizi mmeona hakuna Mkenya analala hospitali chini ya floor. Mmeona? Hapana. Zamani Mkenya analala chini ya floor, NHIF inalipa. Na inalipa kitanda. Na mtu amelala floor. Wamama wawili wajawazito hawajuani, ugonjwa ni tofauti, wanalalishwa kitanda moja, NHIF ilikuwa inalipa kitanda 3. Sasa tumesema license yako kama inaandika hospitali yako iko na vitanda 50, you will only admit 50 patients. Ukitaka kuadmit 60 patients, kwaenda nunua vitanda 10. Na mimi nilienda bunge, wakaniuliza hiyo maneno. Nikawauliza wabunge, nyinyi mnakubali bibi yenu na mama yenu na it is using artificial intelligence, and we have got auditors who will face the consequences of the law. And that is why the digital health transformation is not an optional. It is our shield. Kakamega County so far has received 150 devices. It has trained 269 healthcare workers, and we have begun automating 192 facilities. Additional 497 devices are being dispatched this week, Governor. This is how we build a transparent, accountable health system. Kenyans can now access all SHA services through Afya Yangu app, the official SHA mobile app and portal. It will centralize all our health records. It will show us the facilities. You can do claims. It will give us the coverage. It will empower users to monitor their profiles. And it will help us report fraud via 147. For providers, Practice 360 will streamline the approval. It will create a transparent, efficient, and patient-centered digital healthcare system. At community level, I want to recognize and appreciate Kakamega has 4,250 CHPs supervised, and they're bringing care to the last mile. Nationally, CHPs have already screened millions for diabetics, millions for hypertension, and millions for child health issues. They are our foot soldiers. They are the foot soldiers of universal health coverage. And they must remain motivated with the timely stipends and full support. I had a meeting with the Council of Governors yesterday. There are some counties which have delayed the reimbursement, and we have agreed we will work together. The National Equipment Support Program is ensuring that all our counties get life-saving machines without crippling upfront cost. In Kakamega, 9 facilities, including Mumias, Butere, Navakholo, and Malava, have already placed requests for digital X-ray, ultrasound, mammograph. Installations are going on, and majority of them will be completed by the end of September. Infrastructure is also being scaled up. Kwesero Hospital Complex, which is costing us 118 million, is already 32% complete. A Kombuli maternity, which is costing us 10 million, 23% is complete. And of course, we are upgrading the Omusanda Health Center. These are investments that are shaping strong foundation for service delivery. Level 6 hospital, chair wa health. Ukiona mahali iko wanajeshi, wewe hesabu mwezi. So that hospital is being supervised by KDF. And I'm talking to you as a former Minister for Defense. Mahali ukiona jeshi wana supervise, the architect, the engineers, the conservators are people in uniform. Vile governor amesema in 5-6 months, level 6 hospital ya KAKAMEGA itakuwa tayari. But health is not about machines and buildings. It is about dignity and the trust. I call upon our CHPs, our elders, our leaders, our faith leaders, and our county officials. Let us all be the champion for Taifa Care. Tell every mother, every boda rider, and every juakali artisan, health care is your right as provided in the Constitution. Fraud is your enemy, and collaboration is our pathway forward. So ukiona mkora, na nitawapatia good healthcare workers, nitawapatia 2 examples. And I want the medics to talk to me. Because without you, universal health coverage will not succeed. And that's why when I came, I fixed the issue of internship. Si mnajua hivyo? Paka madaktari wamenisifu sana. Lakini daktari akileta mchezo kwa hospitali yake pia mimi nafunga. Tuko marafiki upande moja, lakini nikikuona kwa fraud mimi nafunga. Wanasiasa tuko marafiki, lakini hospitali yenu ikileta shida mimi nafunga. Wafanyi biashara marafiki zangu, ikifika wewe unataka kula pesa ya patient, urafiki inakushia hapo. UHC staff, I have said it and I have given instruction to my PS. Is accounting officer. Tuko na pesa, wewe lipa hawa watu from September. The money is there, it belongs to them. Unajua hii Kenya unazungushwa tu. Madaktari their CPA, hiyo 1.7 billion, sisi tumelipa. Mimi sina kesi na madaktari. Am I right? I have no case with healthcare workers. And if there will be an issue, it will be the first thing that I will resolve. But, what but? SHA has withdrawn access rights to 12 healthcare workers, 8 doctors, and 4 clinicians. Na kesho tunatoa wengine. Kwa sababu tunaona daktari ako KAKAMEGA. Unanisikia? For example, sisemi ni kweli, but I'm picking KAKAMEGA as an example. Daktari ako KAKAMEGA na tunaona facility ambaye iko Lamu ama Malindi inaonyesha daktari ako KAKAMEGA lakini anafanya procedure is in the theater. Physically he is not there because he is sharing his OTP. So kama wewe ni daktari, wacha niwapatie muktasari leo, healthcare workers. Utapata full bulletin kutoka kwa IG na DCI. Mimi nikupeana. Every health facility we have geo-fenced and we have geo-tagged technologically. So as I stand here, our system can tell me nikiingia kwa gari the surgeries going on in Kenyatta National Hospital. Simazi amesema wewe unasema mama karibu 50 wamejifungua kwa facility yako kupitia C-section. Alafu hakuna theater notes. Unasema birth what?
Birth notification. At
the birth notification? Aye. So if there's no birth notification, let me ask you, can you prove there was a baby delivered? No, mimi nauliza. You know the kind of information our system has. The kind of information we have. Wale watu wanapia kelele kwa nje, waanza wameanza kunyamaza. Because this morning we came, our numbers tallied with the governor. Governor, am I right?
You're right.
Yeah, our numbers tallied with one of the bishop of St. Mary's. Alafu mtu anasema ati, sasa mimi nikitafuta pesa ya umma, am I supposed to be impeached? He? Mbona hii Kenya hii? Ati unatafuta wakora, si ningeimpeachwa kama mimi nakula pesa ya umma? That, by the way, the grounds for impeachment, na mimi nimekaa bunge. The grounds for impeachment is in the constitution. The grounds for impeachment is if I allow public resources to be stolen. Lakini unajua mzee anaitwa Michuki alikuwa waziri wa transport. Akasema watu hawatasimama kwa matatu. Watakaa chini na watavaa seat belt. Walivaa au kuvaa? Walivaa au kuvaa? Hii afya kama umezoea kuiba NHIF, wewe ongojea wakati ile President Ruto hayuko na mimi si waziri wa afya. And the Council of Governors are 100% with us. And we will not shy away. And we will not be intimidated by politicians addressing funerals. Na kama mimi ni kukuja hiyo funeral, mimi nitakuja. Kwani funeral nani atanizuia? Ukiongea mimi naongea. Ukienda harusi mimi naongea. Ukikuja rally mimi nakuja. Hii Kenya, we must get rid of leaders who are dishonest. Yeye ako na cover ya 10 million outpatient. Huyo mjumbe ama huyo senator ako na cover ya ngapi? The people is addressing in the funeral even are unable to pay the minimum premium ya SHA. Yeye ako na mortgage ya 30 million, ananunua nyumba, anaishi Karen, lakini akiambiwa hawa ambaye wanaishi kitongoji duni, ambaye hawana maji, hawana choo vizuri wajengewe, anasema hapana, anapinga. Na yeye anaishi wapi? Karen. Anapata 30 million mortgage at 3%. The patient, kuna sheria analeta yuko bunge inaitwa Quality Care and Patient Safety Bill. Going forward, the patient is the boss. The hospital is not going to be the boss anymore. Mtu alienda hospitali akatolewa jivu. Hata jivu ukipata Dettol, unaenda kujitoa. Mtu ameclaim wakati Mkenya ametolewa jivu ameenda, claim ilikuja ata amekatwa mkono. Hey! Ya mwisho, na tumeona hapa Kakamega. We have seen in Kakamega, healthcare workers, listen to me, eh? Tumeona mtu anapitia hospitali 5. Anaanza na PGH, anaandikiwa dawa, lakini hachukui dawa. 520,000 people. Ilikuwa 52,000. Anthony, 52,000 people passed through PGH. Only 9,000 got drugs. Were dispensed with drugs. So you know what that means? Hata hii story mnaambiwa mtu anaandikiwa malaria na anatoka na antibiotic, dawa yako inaibiwa, my friend. Dawa yako inaibiwa. Unasikia baraza? Yeah. Huyo patient, you know, not all patients are patients. In this fraud, there are patients, there are healthcare workers, and there are doctors. And there are crooks outside. Nyinyi mujiulize, how does 52,000 people go through this hospital and only 9,000 were dispensed drugs? Mbona mtu ako na malaria anapewa antibiotic? Hiyo antibiotic iba mwingine anapeleka kwa hiyo kliniki yake, lakini hiyo ni tutamsaidia. Sisi tutahakikisha kwamba madawa zile zinakubaliwa Kenya. That will be the only one dispensed and paid by SHA. Watu wa Kakamega, mimi na wasihi mujiandikishe SHA. Mwambieni watu wetu at least hata wale hawawezi wapate the primary health care. Dispensary karibu na pale, health center, sub county, outpatient ni bure. Tafadhali mujiandikishe kuwa members of the Social Health Authority. As of today, 25.8 million Kenyans have registered with the SHA. Bila marketing. Jana pekee usiku, kila usiku tuko na mtandao kwa system. Jana pekee 33,000 wameregister from across the country. So it's a very popular thing. Asante Governor Baraza for hosting us. We will work with you. We will finish level 6 healthcare, and when we open St. Mary, I will come myself. We will support the church. We will support all our faith-based facilities, our public facilities, and the private facilities that are doing the right business. Our healthcare workers, you are our core people. Count on me as the Minister for Health. I will always stand with the healthcare workers that deliver quality, affordable, and accessible healthcare. Mungu awabariki.
Thank you so much. May we have the national anthem in the KAKAMEGA County? Be upstanding.